Trevor Field, welcome to the Pain and Performance Podcast, man.
Hey, thanks for having me, Derrick.
I'm excited to dive into some of this stuff. Me and you seem to be kind of kindred spirits in a lot of the recovery and advancement of physical treatment world. So as soon as we were talking, I was like, this will be a good show.
Yeah, I think so. I mean, like, you hear hoofbeats and you think horse, and then when you see another zebra walk by, you're like, all right, yeah, you and I need to talk a bit more. So, yeah, definitely.
So tell us where we're finding you in the world. Tell us a little bit about what you're doing.
Yeah, so I've got a sports clinic in Rancho Cucamonga, California. So Southern California, inland of Los Angeles a bit. We find ourselves in a 30,000 square foot athletic training facility treating student athletes all the way up to professional in kind of all aspects. I myself, growing up in a small town, played every sport, but my passion is baseball. This is the alma mater up top, the University of Minnesota, so a Gopher through and through. We don't cross paths with LSU that often, but yeah, that's what we do. So throwers are our passion, shoulders, elbows, injuries. We just see it all day long. So kind of want to take a deep dive and talk to you about kind of our approach and see if we can't get some of these throwers taken care of.
Yeah, speaking of baseball, I took my parents to the World Series this past weekend. I grew up a big Astros fan. And so we were talking while we were there about, some of these teams and how they treat their athletes. And, my parents were saying like, oh, it's probably this amazing treatment. I was like, you would be surprised, because I've known quite a few of the people who've been around this. And I wish that it was the elite level of treatment that the athletes are putting out on the field that they would be getting in the treatment room. But from what I have seen, that's not always the case. That's not a blanket statement, but certainly not always the case that they're getting great information about how they should be taking care of their body.
There's massive inequity from one team to another. I'll tell you that much in terms of their approach and their staff. So literally have a story of two guys that trained in our facility were traded for one another, which was kind of unusual. So we had a Chicago White Sox player traded to the Arizona Diamondbacks. The Diamondbacks are generally a team that has the least lost games to injury in the league. They tend to be very proactive with their athletes. You strain a hamstring and they are literally having you do a wall sit against the wall and breathe into a balloon to get your diaphragm engaged to kind of be more kind of broad scope. Whereas, a traditional hamstring, people are just stimming, stretching, cupping, whatever, to a hamstring to get them moving. And the player that moved from Arizona to Chicago found themselves going into the training room thinking that, I'm going to do my prehab. And they had one foam roller for 25 guys. So they just were like, if you show up in the training room, you're hurt, and they're potentially looking for your replacement. So, yeah, mass inequities, even at the highest level of sports. So, definitely have seen that with many of our athletes.
Yeah, when we're looking at that, what is the big thing that we're trying to identify with athletes? Is it imbalance? Is it muscle dysfunction? Is it movement dysfunction? If they're trying to prevent injuries, which is, if you got a lot invested in these guys, you would think at the highest level, that's what they'd be trying to do. But from a practitioner standpoint, what should we be looking at in our throwers?
I mean, optimally, you would want to catch them before they're complaining of things. I mean, if we get them to the point where they're describing, oh man, I'm trying to throw across the field and I just don't have the zip on the ball. Well, I mean, we're really symptomatic. You may not even be describing an injury at this stage of the game, but there's a big red flag that's showing up saying, all right, caution, you're moving toward potentially damage of tissue and structure. So we may be just looking at imbalance. And a lot of times what we're going to find is that these imbalances that we do some movement testing on, we see things change from the throwing side to the non-throwing side. And they're just like super obvious that if you didn't know what to look for, you would think, oh, no, I'm fine.
Yeah, we see it from the pain world in that, like, these compensation patterns that people end up with can create significant functional, neuromuscular, and physiological changes that our body does not like. We try and study this stuff, but I can say without a doubt, if you've got a compensation pattern that is allowing you to function now, your body doesn't necessarily care what that does for you tomorrow. And that's one of the things that we're constantly looking for is this your body trying to overcome a deficit somewhere else, especially in our athletes, because if you're in that situation, you're leaking performance or power or speed somewhere else. And so for them, they're excited to dive into it because there's a performance component to it that they see in the everyday life. Sometimes we're not paying as much attention unless we're having pain. But what are those big imbalances that you see when you're working with somebody? What are those big compensation patterns that jump out to you right away when you see somebody?
Oh, I mean, if I were to say, if you had one test to go to and just say, all right, is this person on the path to doing something that's going to be problematic? It's going to be taking the non-throwing hand, the thumb up the middle of the back as high as you get, and comparison to the opposite side. A simple hand behind the back test tells you and can be pretty predictive of a lot of stuff that's going on with that shoulder. So for me, always and forever, you're going to see imbalance because literally, I mean, all these guys who throw really stretch anterior capsule, the front of the shoulder, and posterior capsule gets tight always and forever. Well, you hear of things called GERD, a glenohumeral internal rotation deficit of the shoulder. Well, this shows up functionally as a hand behind the back test, and typically dysfunction really shows up when you see that deficit increase beyond 2 inches. So if there's 2 inches or more deficit between the left and right side, I already know if I go to test your rotator cuff strength, it's going to test weak. If I do a quick stretch to your internal rotation, it's going to come back on. So ultimately I know, like, all right, did I need to go rush off and do some resistance bands to try to build strength in that rotator cuff? Or is this just inhibited from the dysfunctional movement pattern? So you also start to see leaking of strength to the tricep. So a tricep stretch, wrist flexion extension tends to go a little haywire. So even a simple quick stretch to those posterior structures of the capsule will activate a lot of those muscle groups. So you know, all right, maybe I just need to do a proper prep. And then more importantly, what almost nobody does is, what do you do post game? What do you do after your practice? What are you doing after you've done that workout? How do I take care of myself between the time I stop doing what I'm doing and the time that I go pick up and do that again?
Yeah, we're going to have to dive into that because you played baseball. I played baseball. I remember distinctly how good it felt that first month of the season when I could throw without my arm just killing me, and had no idea that was just a part of the game. Like you're halfway through the season, your arm's dragging. We'd get out there and shake each other's arms out and do whatever we could so you could get through the game. And we had no idea what to do to stop that. And I remember getting to college and having a coach say, we're going all the way back to the basics and we're going to teach you how to throw and recover. I play outfield. I don't need to know how to throw. The best thing that I had ever done up to that point, I was like, Coach, if I had found you a few years ago, I wouldn't have been at this small college.
Right.
But it was one of those things that we had no idea how to take care of our body during that. And especially doing this pretty traumatic event, which is, being an overhand thrower in any aspect, whether that's baseball, football, that's a difficult move for your body to handle. So we really have to pay attention to what we're doing around it, before, after, in between. So if you take somebody who's, they're starting to get serious about this, and I want to dive into some of the injury stuff, but I think a lot of people will have kids who are starting to get to that point that are gonna take, a sport seriously, and they're going to take a throwing sport seriously. What is the stuff that they should be doing now, this time of year, because a lot of them are starting to be in this little in-between stage? And what should they be kind of transitioning into as they get back into the season?
Yeah, I mean, obviously this is pretty regional, and for Southern California, there is no in-between season. So
I don't know if there is anywhere now. Yeah,
here becomes the issue. Really, what I start to see is kids start to commit to year-round travel ball by at least 5th, 6th grade now, and by the time they roll through middle school, if you're in a good travel sports organization, softball, for instance, you could be playing 150 to 160 games a year round. it's basically an arms race for all these Southern California girls to get in rosters all over the country. So the coach is like, well, if you're going to do a 4-hour practice on Saturday, our organization is going to do a 5-hour practice on Sunday. So literally, like, we're going to pack a lunch and you're going to be here all day with us and we're going to grind you out. So what I see is like where the breakdown becomes, if you boil down every last client that I had to a demographic, it's going to be a 13 or 14-year-old softball player who's got some massive overuse injuries and imbalances up and down the body. So if you're somebody who's, moving from the recreational side of things to being more serious, one, we need to have some foundational assessment to figure out, all right, where is our core strength? How does our hip, how does our center of our body move? Because without, proximal stability, there is no distal mobility. You're at risk of kind of unwinding a lot of problems throughout the body, whether that be the shoulder, the elbow, the neck, your hips, lower back, knee issues. So for me, it's just like, all right, can I get myself in the hands of a professional who knows how to assess movement properly and figure out where are the weak links and what do I need to be doing individually to kind of take care of those weak links? Yeah,
it's probably a good time to try and shore up some of those little deficits, movement patterns, weaknesses is during that downtime, and probably take a break from some of the repetitive movement and put a different impulse into the body.
Yeah. So, I mean, cross training is, what we used to think of as like the 80s and 90s, or the Bo Jackson of the world who was a multi-sport athlete. Yeah. I mean, certainly we are in the age of specialization, and coaches, particularly in our area, really discourage performance in multiple sports. They think you're going to get behind in some way, but you don't understand the advantages it has for your body to move in, multitudes of different ways to make a more complete athlete.
I read a study, and I'm going to mess up the numbers, but it was something like, of professional athletes today, like 50 to 60% of them were two-sport athletes. Don't quote me on the exact percentage, but it was high, like a much higher percentage than normal, which goes completely against what all the travel ball coaches and little league coaches would tell you, that these people who get to the highest level, a high percentage of them were doing multiple different things, moving their body in multiple different ways, acquiring skills from multiple different sports. And so you see that at the highest level and you're like, okay, well, why aren't we doing that in our everyday lives, in our kids' lives?
Well, it always made sense to me that you saw this athlete as a pyramid, and the foundation of that pyramid of an athlete is movement. The next phase becomes the strength and conditioning of that athlete. That's the thing that's going to set them apart. The very smallest part of that pyramid, the very top, is their skill. So what we see is a massive imbalance of athletes focusing on the one thing that is the smallest part of that pyramid, and spending and investing the most of their time, energy, and money toward the thing that makes the smallest amount of difference. So yes, somebody's going to have some natural talent and some skill, but they just, pound the heck out of this one component of you being a complete athlete, thinking that that's going to get them to the next level. And it's really, it's a disservice to that athlete, because likelihood is they don't move well, or they've only done this one specific movement to create more imbalances. And now they're out of the sport because of an injury or a surgery or something they could have avoided if they just kind of focused on being a little more all around.
So you talked about the little internal rotation or back scratch test, that if people are trying to like scratch in between. What's some of the other big assessment tools that you have studied? Some of this is self-serving. Like, I remember whenever I was in college, they came, and this was when like the FMS was just starting to be implemented in baseball. And so they came and did a functional movement screen on us. I don't think they quite knew what to do with the answers of that, because we never got any like, okay, this means you need to work on blah, blah, blah. We just did it, and our coach was like, okay, so that's supposed to help.
Right.
But what, is that still a really good tool for athletes? Is there some other assessment tools that you like, or some assessment moves that tell us about imbalance or compensation that people should be doing?
Yeah, I mean, our profession loves kind of studies and these type of things. But for me, I've always been obsessed with observation of my own. Like, I feel as close to, our education gave us a foundation, But my brain has always been one to let's solve these problems. Let's look deeper. Let's figure out what the heck all of this means. So when you were left with the FMS and now what the ... for me, it's now, all right, here's the imbalances that make a lot of sense to me. So a quick test for me is to do a simple laying supine with your knees bent. Let's bridge up 2 inches, lift the hips 2 inches, and just slowly march. Can you lift one foot and set it down and the other foot and set it down? And what is your pelvis doing? Is the pelvis rocking side to side? Is it dipping from one side to another? If we don't have rotational core stability, then you mentioned earlier, you're leaking performance somewhere. Well, if I can't transmit force from my foot from the ground through my core to my arm, the only possibility of me throwing harder is to use my arm, which is where all of this starts to go wrong. So for me, that's a real simple test that I've not seen any studies on whatsoever, but it's one that I see over and over and over again. That's just like, aha, here's the weak link. Here's where we need to be spending our time, is opposing the force of rotation in your core. So, I mean, it's a simple test, and it's one that people fail over and over and over again.
I love that, because there's places around us that are throwing specialty centers and in rehab. That's what they treat. We treat baseball injuries, and we get patients all the time who come in and had done some treatment and did not get the results that they wanted. And look, everybody's different. So, nobody's completely up the wrong alley. But the big issue I see with practitioners when they're not improving is that they are microscopic in treating the problem. And they have a difficult time in zooming out and looking at the whole, functional structure that is the human body, and how all of this stuff relates. And we'll see it, you start, getting into a thrower's, lat and, QL, low back, hips, and you start finding all kind of functional issues in there that if you continue to treat the rotator cuff or the bicep tendon without correcting those things, you're not actually getting to the root cause of why there was pressure on those structures in the first place.
Correct.
And so when we zoom out and you give these people a few sessions and they're like, man, I feel amazing. Why wasn't this done before?
The ball is exploding out of their hand. They're seeing more run on the ball. It's not tailing off at the end. They're smacking the heck out of the ball and seeing that they're hitting with more power. It's just like you've taken the brakes off of them. They've literally been trying to do everything with the brakes on. So yeah, it's part of our philosophy is literally we've got to remove any obstacles or impediments for you to be the best version of you. So literally finding these points where you move in efficiently, that's it. It's not rocket science.
Let's stay on that test for a minute. So if I'm a right-handed thrower, and sure, I do my internal we're gonna build a case study here.
Sure.
And I do my back scratch test, and my internal rotation on my throwing side is limited.
Sure.
And I go to do the little bridge marching test, and we find that
here's what you'll find first is when you lift the throwing side foot, that's the side where you tend to see more dip. That's the side that's dysfunctional.
So that would have been, so if I see that, what's the next step? So that, this is what they got to with us.
Here's where you're going to see this multitude of findings. You're going to see the hand behind the back test. You're seeing 2 inches or more deficit between the two. I automatically know when that's off. I go to test your rotator cuff and you do some external rotation, that arm's going to collapse. They may not have pain, but they're not going to be able to hold. And they're like, oh man, it didn't hurt. You go to test the other side, it's solid as a rock. And, you pat them on the back. If they're a right-hander, you pat them on the back. Great news. You're going to be a left-handed pitcher like you always wanted. But ha, ha, ha. But ultimately, when you see that this thing breaks down, you're going to let them know, this is dysfunctional, and I'm going to turn all this stuff back on in the next 3 to 5 minutes, and you're going to see that likelihood of whoever you were told to do all this band work, you were wasting your time because you're just living in compensation. The next findings are going to be, as we said, that tricep's going to test weak and the wrist is likely to test weak. when we do that bridge and march test, one side dipping is going to tell me if without rotational core stability, what structures take stress? The lumbar spine. So the likelihood is some of the neural output from the lowest segments of the spine are not functioning well. So on that same side, I can test your ankle, and dorsiflexion is going to be weak. Hip abduction is going to be weak. So we're going to side lie and see if they can develop some strength and power on that side. It's going to collapse. And they're like, damn, I'm weak all over the place. The simple kind of next move is to start to begin to clean it up. So I want to just see any questions to this point, and we can kind of easily walk through what we can do to do something about it.
Yeah, let's dive into that. Like what, of course, look, if it's ideally it would be something that people can do to prevent this from needing treatment. Obviously, if you're getting to the point where it's really affecting you, you need to get in with a professional who's going to check you out. But if somebody is at the point where like, hey, I'm seeing this stuff, I don't feel bad. I'm performing fairly well, but I don't want it to get to that level either. What's the things that I can do if I'm wasting my time with some of the band work? Where should I be focusing, my 20 minutes, 30 minutes of prevention as part of my, kind of training? Yep.
So if we're lacking internal rotation, we have to restore it. So the classic is the sleeper stretch, where we're laying on that throwing side, elbows up at 90 or shoulder height, and rotate that hand down. So we're stretching the posterior cuff, the posterior, like not only the contractile tissue, but the connective tissue, because the capsule tends to also follow that and start to shorten. So we've got to get some posterior capsule stretch to that. And for me, if we're going to do a stretch, our hold times, we generally have a 20-second hold. 15 seconds by the research tells us we're going to lengthen out some of that tissue. I'm going to give you 5 seconds for the gap of somebody counting too fast. So I'm going to get you out to at least 2 minutes total on stretch. And for me, all of those prolonged static stretches happen after you perform. So what we don't want to do is stretch that rubber band pre-performance, because can we generate stress on a rubber band that's been stretched out? No, we can generate power on a tissue that's been warmed up and lengthened out, but we don't want to sit and do. So the good, and mentioning studies. So there's a good vertical jump study that said, all right, if I do 2 30-second hamstring stretches, it can actually reduce my vertical jump by up to 2 inches.
Wow.
So for me, all right, that just tells us, do we do prolonged static stretches pre-game? No. Pre-practice? No. This all has to happen after the fact. So this needs to be in that prevention kind of time frame, which is going to be after performance. So we've got our sleeper stretch, or something to get us some internal rotation. If you can't lay down on the ground, then you just put your hand behind your back somewhere around your pocket, get a nice little chicken wing with that elbow, and get up against the fence and lean into that to kind of stretch the posterior structures of the shoulder. Same deal, 6 20-second holds to get that lengthened out. And now, always and forever, just compare to the opposite side. I don't want to get to the point where we're overstretching structures. And symmetry is probably not ever going to be a true goal of this, because we're always going to be throwing. We're always going to have load. So I don't want you to obsess about just feeling equal always, but it needs to get closer to equal. And then getting into some of that lower body stuff, the biggest thing is stretching hip flexors, because that tissue structure crosses the spine, and if it's compressed in some way, we're going to kind of shut off some of that nerve output to the hips.
Yeah, we see in a lot of these cases, when they have gotten so much to the point where their rotational imbalance is really restricted. We see this with a lot of hitters. When you talk about the hip flexors, the amount of compression that can be generated from the hip flexors through the spine is incredible. I've seen 2 baseball players that created lumbar fractures because of unchecked hip flexor compression during sport. And these are young kids. We're talking teenagers that cause fractures in their spine because they just continued to tighten and shorten and tighten and shorten. And that tension across that undeveloped skeletal frame was enough to, at some point, fracture the transverse process of the lumbar spine. So when I'm telling people, like, this is important, this is really important.
Yeah, absolutely. Because the other side of that is the same thing with my sprinters and otherwise. And baseball, you have to sprint as well. And you'll see femoral acetabular impingement, and a lot of that comes from those anterior structures like the hip flexor being too tight. You're seeing kind of stress fractures in the hip as well develop in our sprinters and otherwise, and it has almost everything to do with that hip flexor kind of dominating activity down there.
Yeah, my sophomore year of college, I started to get left-sided hip pain. I'm right-handed. I hit left and right-handed, but I'm a right-handed thrower. And that continued to get worse and worse until I was diagnosed with a labral tear. And the ortho that diagnosed me said your hip got so tight that it was just sucked in there. So every time you were twisting, you were just tearing at that labrum. And I was like, are you telling me that I tore my labrum because my muscles are tight? I never liked stretching growing up, which is kind of funny that I do this now, right? And he was like, there's not a doubt in my mind that if your hip was more mobile, you wouldn't have torn this. And I luckily, and also this kind of shows you the power of the body, I found the right treatment at some point and didn't have to have surgery, but I got very, very close to surgery over the next couple of years. And it, like, when I look back at the whole life cycle of that one injury, it definitely shows how much attention we should be paying to the whole body's mobility and pliability of these muscles and these structures in our athletes, so that either they perform better now or they can perform better for longer. They don't get injured if they get to that next step. Because like you said, if they're all playing year round now and they try and go to college or they try and go to the professionals, that's going to create a very, very long time where the body's dealing with that stress. At some point, it just can't deal with it anymore. It can't put those fires out. And if we haven't created some change in there, it's going to give. Something's going to give. And so I think that's the big focus for people, is knowing that they need to do more to the whole body to take care of themselves and create balance. So I think I sidetracked you. We got the thrower stretch. We got hip flexors. What else should they be focusing on?
Well, I mean, for me, if we can get some rotational core stability engaged, so like for me, I'll even use that bridge with March, not only as a test, but also to try to gain some stability in that. So can I now put my focus into maintaining those hips being level and trying to do a bit of a march and try to resist some rotation? At pregame, if it isn't something where you've had the opportunity to build up enough of a foundation and you're, putting yourself out where, I know I'm not a finished product, I know I got a lot of work to do, is there something quick I can do to try to protect myself? Then I would have them just lay on their back, drop that same sided leg up to about 90 and cross over, just to open up and gap some of the segments of the lumbar spine so those nerves can kind of communicate with that hip and turn some things on. So for me, there's some quick fixes, there's some kind of hacks, so to speak. But I mean, that's for the temporary. That's for like, if you're going out and like, I have to be out here because there's a scout, this is a tryout, I need to be there or I'm going to lose my spot. Then there's some things you can do right now to turn that stuff on. But in the background, you need to be getting with somebody who can kind of really specifically, address this with you.
Let's dive into recovery a little bit. So, for a long time, the pitchers did all the throwing recovery. We didn't think about it a single bit, and you've heard how that got me into this wonderful position. If it's perfect, if it's optimal, what in your mind builds this nice recovery system? What components, what therapies, what technologies would be an amazing part of a recovery program for throwers? I
mean, here's what it was for pitchers. So you mentioned kind of pitchers only. I mean, you used to think that pitchers would probably be on the track team because they would just put in mileage, because they would do something that they would just say, flush out all the soreness, flush it out, get your body moving. I mean, still the concept makes a lot of sense, but the methods have changed a lot. So instead of being a distance runner to kind of flush everything out, we do have tools. We have PEMF devices, that pulsed electromagnetic field devices that can encourage blood flow, circulation, nutrition. People do things like the Mark Pro, which is a device to try to create a muscle pump. So it's an electrical stim unit to try to create a pump. it's starting to go away. I mean, it's still hanging on for dear life is icing. And it probably, in my opinion, needs to die to some degree, because icing, in terms of recovery, when we do just prolonged 20 minutes of cold, we get that vasoconstriction, and that's cool. I mean, we're going to stop some of the inflammation from building up, but you've also reduced cellular metabolism in that area, so you can actually delay some of your recovery. Yes, you get that re-warmth, and you can perfuse new blood in that area, but for me, can we do something a little more effective and do some contrast of that? So going between cold and hot to try to get that quick dilation or compression of the blood flow and circulation in that area to improve it. If there are kind of point areas, there are things like infrared that can assist in the recovery of that. Soft tissue mobilization, getting yourself in the hands of somebody who can actually physically, mechanically, move some of these tissues on your behalf. So there's percussion guns and other tools that are really effective in moving some of this stuff around. So, I mean, what we have to do is figure out, every athlete's going to have a little different stress, and we can kind of customize it to what specific position they play and those specific demands that each muscle tissue has to be focused on. So, I mean, we can be talking in generalities of some tools that you can use, but to focus this down and say, all right, I know a catcher squatting that many times is going to have a very different demand than the guy standing out in left field.
Yeah, definitely. So if we stay, I laugh whenever you say the pitchers thing, because we would always talk about it like, I just don't want to pitch because I don't want to run as much as those guys. Like half the baseball team did not become pitchers. There's a whole era of people who probably could have been great pitchers that didn't do it because they didn't want to be running 30 miles a week just so they could pitch.
I'll tell you a story. Like I had 2 shoulder surgeries coming out of high school, so I was good in my small town. I had a workout with the Cincinnati Reds when I was 16. I was pretty good. So by the time, because I was in a small town, I was also playing quarterback, and being the biggest guy on our team, bigger than our offensive line, and we threw every down, I ended up not being able to follow through or use proper mechanics. So my ball and socket just slammed into one another and ended up with a Bankart lesion that required surgery. So I played through a torn cartilage in my senior year and got an operation. So I played in a small community college locally until I could get down to the U of M. And the amount of running that we did was absurd. I really thought I was part of the Arkansas track team. And to understand, like, what these coaches thought they knew about recovery and what they thought about conditioning the body, it's like, already as a junior college student, I was like, we're training the wrong conditioning system. So I'd get a pinch hit opportunity, and now I have to sprint, and I tore my quad. Well, think about it. I wasn't really training the right energy system to begin with to be able to provide that kind of demand. So, I mean, it's still to this day, I'm sure, happening all over the country where, people think they're doing the right thing and it's just not appropriate.
Yeah, these slow changes, the rest ice compression thing has been hanging on for decades now, despite us kind of knowing there's very few times where that really is the answer to these things. But to go back, so if in a perfect situation, if you've got an athlete who's coming off of, let's stay on a pitcher because I think that's an easy one that really needs to change. Would that be like, I threw today, I'm going to go do a PEMF session, like full body PEMF, some targeted maybe towards the shoulder, get that blood flowing in and around those tissues so we can kind of get all the nutrients and repair, shut down some of the inflammatory and trauma response that's happened from pitching, then do like some percussion stuff through some of that the tissues, the posterior capsule that has been stressed. Would it be that day? We can get it that day, but I mean, within a day and a half, I would say is going to be optimal of when we should start. So we got to kind of stay in front of it. I wouldn't go past like 36 hours from getting something like that done if you really want to be moving as fast as you can toward recovery. Nice. Yeah, we did a recovery program with some of the high school football teams around. That was basically that. They would play. We would try and get them in within 36 hours. And what we found, the people who stuck with it the whole season, non-contact injuries went down from the previous year, from 6 of that group to 0 with proper recovery. So this year we'll be doing some of the baseball teams, and we've asked the coaches, like, can y'all like track and document who was dealing with soft tissue injuries over the last 2 years, and then let's collect some data this year of what proper recovery can actually do to change your team. Because look, if you're in a small school, one injury can change a season pretty dramatically. And I mean, this goes, I say a small school, I mean, this goes all the way up to the professional level. If you lose an important component because somebody's not recovering well, and, they miss at the worst time, like our whole season, all the work we put in all season is now ruined.
Exactly.
Because, we had an inopportune injury. That's good stuff. What else are y'all doing? Are y'all talking to athletes about doing from a recovery, rest, kind of in between performances standpoint?
I mean, our biggest thing is when we're trying to get somebody to do a more comprehensive recovery, we're really trying to get them to move through the hips and core primarily. So obviously we've hammered it a lot, but to get in the hands of people, like ultimately people have heard and continue to hear now that the hip flexor is the key to everything. What some of this is, we've got to stop people from getting bad information, because as much as I think the hip hook and the sew right and some of these tools to release some of these tissues are good intention wise, I think we get to a point of like, hey, this is going to be the solution to my problem if I just free up this hip flexor, thinking that, well, you know what, who are we actually putting these in the hands of, and do they understand the anatomy enough not to perforate their own bowel, So I always kind of caution people to be like, yeah, it all sounds well and good when it shows up on online and you think that's the solution. It's for us, it's information getting in people's hands, and it's why we do things like podcasts, because we can only put our hands on one patient at a time. And if we can disseminate proper information, it hopefully, this good speech is going to, wash out some of the bad information that's out here.
So if we're looking at kind of the whole, athlete and how they're, performing and how they're taking care of their body, you mentioned PEMF and blood flow and how that works. Let's dive into some of that stuff, and we'll kind of talk about some of the wearables and some of the technology stuff that is starting to come out for these people. But let's stick with PEMF. Give me your spill on what that does and how that can help some people.
Well, I mean, people don't really fully understand it yet. I mean, a lot of people still have the question, is it the same as electrical stim? Like what's really different about it? Well, depending on the power of the PEMF device that you're using, occasionally you can see muscle contraction out of it. And of course, there's going to be some mechanical applications of what PEMF can do. But electrical stim really is stimulating the nerve and potentially getting a muscle contraction to mechanically move inflammation or blood flow or circulation in the area. Whereas PEMF, you get down to the cellular level, and that cell membrane itself now is more permeable. So that's important because we can actually move some of the electrochemical conductance of this, charge up the cells of that area to be able to repair at a faster rate. So my personal experience with using PEMF is when I got this device, because I still play baseball, I had slid and had taken a good portion of skin off the outside of my leg. So another raspberry, chalk it up to me doing this a million times, and it's probably barely skin at this stage of the game. So the fact that I normally do this and it's all right, a couple weeks still scabbing, I got to keep it covered, whatever. I do my normal wound care regime. I had gotten the PEMF, and literally because we use a guided PEMF unit, I'm constantly having this field move through my body. This wound was all new skin and closed in 5 days. So the fact that I already know, all right, the energy level is completely different. How I can allow tissue to recover, skin to recover, ligaments, tendons, muscles to recover is, second to none. Secondarily, as a mid-40s pitcher, it's a lot of stress on these kind of tissues at this age. But I still throw complete games. I still throw 9 innings. And having used this and guided it through my body as much as I do, I don't get sore anymore. So normally it would be a Sunday game, I know Monday and Tuesday are going to be a little sketchy when I'm getting up and down, that my glutes, my upper back is going to get tight, but soreness in general is nearly eliminated. So unless you've really got some significant trauma to tissue, how it's going to help you recover and then move on to be able to condition your body. So really kind of the assistance in steroids isn't necessarily with what you can get in that workout. It's the recovery so you can push hard the next time. Well, how many people want to get on steroids? Well, maybe there are a few out there, but don't. Not optimal. You can get those same kind of benefits and get recovery to be able to push hard to be able to get those benefits through the use of PEMF.
Yeah. Have you heard about the Race Across America team that started using it like in their vans with their riders?
Uh-uh.
So this was, and it's documented somewhere. I'll pull it up and throw it in the show notes. But so when PEMF first came out, everything that you just said, they were starting to recognize that it was building recovery was much, much better. And so Race Across America is basically America's form of the Tour de France. So you have a team that's on bikes every day. They're riding these difficult routes. And so by the end of this like 20-day race or whatever it ends up being, you're just dealing with what team recovered the most and still is performing well. And so one of the teams decked out this van with PEMF units, and after every rider would get off their bike, they would run PEMF sessions. They broke the world record that year. So they went from like decent team, it's not like they were bottom of the barrel and went all the way, but decent team to breaking the world record by recovering better in between each one of those using PEMF. So from a sports performance, you're like, I'll pay attention to that. I like world records.
Exactly. There's definitely something to it. I mean, there's good evidence about, and in the 1970s, PEMFs were FDA approved as bone stimulators. So you already know, all right, when non-union fractures are happening, you're getting stimulation of not just the soft tissues, but literally anything. So if you're dealing with what you were dealing with in your hip in terms of a stress fracture or, a labral tear, some of these tissues, poor blood supply as it is, we can actually apply some of this stuff to tissues that really, is there a way to accelerate it other than give them rest and allow the body to do what it needs to do? Well, that's how it used to be, but that's no longer.
Yeah. One of the questions I had when we were talking about like throwing and, sports recovery and all that stuff is how do we balance improving performance with injury prevention? How do you think about that?
Well, for me, I mean, when we do some of these movement tests, really you're just kind of investigating top to bottom. So like you said, a lot of places just, put that narrow focus on a shoulder or elbow with a thrower. When you start to take the athlete into consideration top to bottom and you see, all right, what moves well, what doesn't move well, and you start to eliminate some of these things. We talked about taking the brakes off an athlete. Literally, I mean, these two things to me go hand in hand. If you can't move well, then the amount of effort you put into your strength and conditioning program to get better is somewhat wasted because you've got inefficient movement patterns. You may be actually building toward an injury when you think you're getting better, faster, stronger, or you're spending all that time, as we talked about, moving in and just continuing to perform your skill going through all of this training. You're not doing that foundational movement. So for me, identifying what tissues don't move well, where there may be not necessarily weak muscle. I always communicate with patients, is it inhibited or is it weak? Is there something neuromuscularly that isn't happening that could be? So for me, if you don't get the foundation set, then, I mean, performance always is going to suffer. Your injury risk is always going to be higher. Like these two are just married. They have to be married.
You bring up an interesting thought, and I'd love to get your input on it. The beliefs and the confidence that athletes have about their body is really important to their performance. So how do we have these discussions about what things maybe aren't as optimal as they should be with a high level athlete and not necessarily negatively affect their kind of beliefs and mindset around performance, around function? Is that something you've ever given any thought to?
Well, in certain ways, because there's some things that where people think they need one thing is what I'm kind of hearing, but they need something different. Is that kind of the vein that we're going on? And it may, like, by taking some of that away, you're maybe undermining that athlete's confidence in their regime, their regimen that they like to do.
Yeah. Let's explore that a little bit. I think of it in two ways, just while you kind of think about that. Like, yeah, there's the athlete that's like, I have to do, my stretch routine. I have to do my prolonged stretch routine before a game. That's what helps me play well. Whenever I don't do it, I play badly. Like, if that's their thought process and they believe that, then no matter what we do, if they believe they're going to play badly, they're probably right. It's such a cognitive game whenever you get to the highest level, because, that confidence can change things. And with a normal patient, we could kind of be like, look, this muscle is a little bit tight. It's not firing real well. We're going to get it taken care of. But their performance doesn't hinge on us on that, them going all out on that. It's not something that I've thought about very much, is like when we're communicating with an athlete, is there another way around that, or is it something that we need to be aware of?
I think you can break into some of that kind of ingrained thing that athlete holds on to if you're just, number one, what I'll tell you is all these athletes obsess about the smallest little thing. Well, they're trying to turn over every stone to try to be the top level athlete that they can possibly be. So they're generally receptive when you can educate them. You're not just going about saying, hey, we're going to change this. Like, if they're not bought into the why, they're going to hang on to their kind of hard felt, gripped onto belief systems and never kind of totally do what it is that you need them to do. But for me, I think at this stage of the game, I've developed enough of a reputation locally where it's like, hey, whatever this guy says, I'm going to do. If you're dealing with somebody who's maybe not developed that level, you got to take that individual and walk them through each individual step of, this is what this does. This is why this needs to happen in this way. This is why this has led to this problem. This thing that you've done over and over and over again, we may have to adapt or make some small modifications to it to make sure that we can optimize this particular issue that we're having right now.
Yeah, the way we think about like problems and pain and physical function is like there's the physical, and that's kind of the movement, the muscles, the bones, the position. Then we have the chemical, which is your inflammation, your blood flow, your cellular, kind of byproducts, all of the release hormones, all the things that make up the chemistry. And then there's like the beliefs, the mental, the emotional. And when we get really good, we've got all three of those working in concert together to make this amazing performance. But if just one of those is lacking, it's the gear system. It can just throw the whole thing off.
Right. And it kind of takes me to like the Henry Ford quote, whether you think you can or you think you can't, either way, you're right. You're right when they say like the mental aspect of this thing is huge. So the thing I always go to is, well, what is the when studied in kind of drug studies, because that's probably one of the most studied things that are out that have data, and they have to basically find what's the level of efficacy for this drug to actually be proven that it works, or is it a placebo? Well, it's actually 41%, I want to say. So if the power of the mind is you believe that this thing's going to work, damn, like if I can get a patient to improve 41% just from their belief that they're going to get better, then I'm a good clinician, because I know
we're
I can
almost
get
halfway there.
41%.
That's great. I didn't realize that was the number.
There's a threshold. I want to say it may have changed or moved in the decades since I came across that number, but I want to say it was 41% is the threshold to be proven that it's just not in your head.
So we talked quite a bit about kind of the the mobility and improving kind of the core strength in these athletes to help with both performance and prevention. Is there any other lifting type things, like certain types of exercises or plyometric stuff that we should be having some of our young athletes do? Certainly now, kind of, in this little off-season time, that helps a lot, that you've seen help a lot?
So, I mean, there's a couple of kind of standard things that I've seen that when you're saying, all right, what is it that I can be a more powerful athlete? What is it that I can be a more efficient athlete? Is there a way that I can reduce my injury risk? Well, if they can get their hands on a dynamometer and do some grip strength testing, their grip strength is going to be predictive of whether or not they can protect the UCL, the ulnar collateral ligament of the elbow. So if there's some things we can do to start building up grip strength, those muscle groups are going to help support the elbow in a big, big way. So for me, here comes the brag and boast. I'm undefeated in the grip strength test in 20 years of being a clinician. So come at me. I get a chance to challenge you back. If you can put it on film and you can get over 185 pounds of grip strength, then let's have it. So
there you go, listeners. Y'all got it. Somebody out there. I've got to have one of these farmers.
Got it. But it's just, I've got my small little window, and I can be the champ of my own little corner of the world. But let's put it out into the internet world and see who's got better than 185 grip strength. I get an opportunity to challenge you back. I'll put it back on video. If you can up the bar, just give me the opportunity for a rematch, and we'll put that on video also.
Yeah, but, tag us both. We'll make some fun package for you for that. If you beat it, you get something. We'll figure out. You get something fun. Got it.
So now, the other thing that we start to see is there's just some factors to be a 90 mile an hour thrower. So the lifts that we tend to see is a split squat. So we got to actually do a bit of split squat work. If you're somebody who doesn't do a great deal of lifting and you don't have the fundamental base to be able to go into split squatting, do not start there, because that is a more complex single leg type activity. If we've got to just start with some body weight squats, building up to dumbbells, building up to goblet squats with a kettlebell, and then getting into more of the Olympic lifting type of things, then we can start moving into a split squat where we get into almost a lunge position and start stacking some weight on. So those are muscle groups that have to be built to be a more explosive athlete. So if we can get those things done, then life's going to be pretty good.
I remember, and I would like to know if there's updated research on this stuff. At some point, they were trying to figure out, what did people who threw really hard do differently than other people? Were they stronger? Did they have a different range of motion than others? And if I remember correctly, they had two things. They had a little more external rotation of the shoulder. Like, they were able to externally rotate, which probably gives them a little more of that whip effect when they were throwing. And I feel like the second one was bicep strength, which was a very strange finding, that not that anyone would have thought that was the big shift in there. And I'm sure it's all, it's technique, it's some of that stuff. But if somebody's working to throw harder, we start generating more power in the legs, and we're doing some of that. And I love that you brought up grip strength. I've seen so many people who improve their grip strength, and everything up, shoulder, elbow improves dramatically. Do you know of any kind of more recent data on, metrics that hard throwers have that are different than people who can't get above the 90 mile an hour?
Yes, but there's some related to almost like body weight. So there's actually for a lot of people who are trying to stack on mass and struggle to do so, I mean, that there's actually some evidence to say, hey, look, we just need to get you bigger, stronger. And there's a component to that as well. But I would kind of caution, the bicep thing makes me a little worried, because that might be an incident to finding and not something you want to train for. Because the thing that I tend to see is, okay, what is the potential consequence of either overactivation of the bicep in the throwing motion or overtraining of the bicep to try to get acceleration? And that's going to be, where else does the long head of the bicep attach? We're looking at potentially dealing with a slap tear in the labrum of the shoulder. So I would be a little cautious to be, hey, look, let's spend a bunch of time building biceps right now. I tend to be like, hey, those mirror muscles are probably factors that are going to cause us to have a lot of problems, because the factors that I tend to see most in dealing with people who are dealing with shoulder and elbow issues is, number one, the pectorals are too tight, so they love either a chest press or push-ups. The lats are too tight because now they're doing a lot of either lat pull-downs or pull-ups to try to get bigger, stronger, faster. I mean, not to say don't train those muscle groups, but just understand that by overtraining or by not creating mobility and strength simultaneously, if we shorten those muscle groups, you're going to end up in a big bad space. So you mentioned kind of lay back or external rotation. Pec tightness is going to limit external rotation, and lat tightness is going to limit external rotation. So, I mean, just keep those two things in mind.
Yeah, that's the key components that I think, at least from a pain perspective, that we end up seeing for people is that shoulder is just locked forward. We got that humeral head pulled forward. The posterior capsule is shortened because that space has now got to be closed in. And so everything about their body is trying to keep all of that stuff forward. And at some point, we're gonna kind of end up with the tipping point, and an injury or performance is gonna finally give in. Is there some really good posterior capsule stretches that you like? You talked about the little like thrower stretch where they're kind of doing the rotation. Do you like any of those, like posterior mobs where they're holding a kettlebell and trying to let the arm drive back in the socket? Is there anything good like that actually works?
I mean, I do kind of keep that to a dull roar. I tend not to try to overstretch it, because the other thing is, like, when you give an athlete a hammer, everything looks like a nail. So for me, it's like there's a point where, do we want to flood more information and more stretches and more things for this one specific deficit? I would be a little wary to say, all right, here's some techniques to use. I mean, there's techniques out, just, do what feels best to you right now. There are some kettlebell mobs. There are some things with the internal rotation stretching to get the posterior capsule involved. But I would just be a little wary to start throwing, hey, here's the third and fourth and fifth thing you could do to get. That's like, all right, I think we're getting in a little too deep.
Yeah. Especially if you're dealing with, I think, younger athletes that are, kind of, you have a difficult time getting them to follow through with anything. The one thing you do consistently is better than the perfect thing that you do for a week.
Correct.
So, this is awesome. I think there's a lot. If people are, working with a young athlete, they got kids that are throwing, let's say, teenage all the way up to college. What would be kind of your parting prescription? Like, hey, here's the couple of things that you should be doing, on a weekly basis. Make sure you get some of these things in, and here's a couple of things for you to maybe ask a healthcare provider.
Absolutely. So, I mean, when we're dealing with young kids, here becomes the issue. I think we get to a point where we're trying to push them to be little pros. Like, we got to find at least some balance somewhere. I mean, everything's just right now become the nuclear arms race of youth sport. I mean, we got to tap the brakes a little bit, because if we're seeing 160 games plus on immature tissues, we can do everything right. It's just too much. We can do absolutely everything right in recovery, in training, in movement, but there is a point where too much is too much. So I would be just making sure that we're finding the levels that you can continue to enjoy the sport, because like longevity is going to be key. Sometimes your best ability is your availability. And if we absolutely just burn through these tissues in childhood, there's no coming back from some of these type of injuries. I mean, we've done a great job of employing all these new tools and new recovery strategies and tactics, and it helps. It does. But we need to kind of be a little bit cautious about, just going wild with all of this. Now, when we do say, all right, great, we're having fun, we're doing this the right way, we've loaded, they've got the proper time off and they can do these things. What I love to see is that we're getting routine maintenance done with a professional. So being able to find somebody who can do periodic maintenance preseason and just a monthly to every 6 week in-season assessment, just to make sure that we're not developing any of these imbalances that are moving you toward injury, or that you're putting the best version of yourself out on the field every week. The other thing becomes, like, be very conscious about seeing how performance is doing. Like, there are tips, there are little tells on the field of how performance is beginning to lag, and how that's going to relate back to things that we can take care of in clinic. So when you start to see that ball start to dive, it doesn't make it to first base thrown across field. If you start to see that arm shaking after a throw, or that, they're not just moving in the same way that they were moving, carrying a backpack or otherwise, those are things that, look, we got to get on top of and in front of this stuff right now. Go through some of these self-tests. So I've got an easy 3 simple self-tests for throwers on our website over at formfunctionpt.com. Download that free ebook. I'll tell you, that's probably the easiest thing you can do, to just periodically self-assess to see if any of these things are showing up. So that would be probably my best piece of advice for you.
Love it. Yeah, we'll throw links to the little self-test and to Trevor's website in the show notes for everybody. I know we've been talking a lot about athletes and throwing and everything, but one thing we ask all of our guests is, if you could tell people one thing that they could do to get healthier today, what would that one thing be?
One thing to get healthier today. Man, movement is life. I'll tell you right now, physical therapists are movement specialists. And what we tend to see is, just like we talked about with our athletes, they continuously do the same movements over and over. We need variety. Your body needs to move through its range of motion, its normal range of motion, not your just lifestyle range of motion. Like, people like to just get out and move and dance and do whatever, but you need to kind of get back to some of this primitive lifestyle that we used to do before we lived in a society where we sat in chairs and stared at each other through Zoom and looked down. We got to take our joints through their full range of motion on a very frequent basis. I mean, motion is lotion, and if we just don't create variety, I mean, we're going to end up. So we don't get old and then we get stiff. We get stiff and then we get old. So if we don't move enough, like, this is the direction we're going to head.
I love it. That's a very good one, and I think that's the first one on that is move a little more, move differently, find some of those ranges that are a little bit funny. I love that. That's perfect. Well,
if you want to get to some primitive stuff, you can follow Ido Portal. If you've seen or heard of this gentleman, he was I think a coach for Conor McGregor for a hot minute in terms of some primitive movements. And if you want to see some unusual movements that your body can do, that I would challenge anybody to try, and that could be a challenge, a monthly challenge, Derrick, you could put out for your people, is pick out something that Ido Portal does. It's pretty interesting.
I love it. Awesome. Trevor, thank you so much, man. This has been brilliant. I think that there's a ton of wisdom in there for all of y'all. Make sure, if you got young throwers, get them to listen to it. They get this stuff more than you think. But certainly, take into consideration everything that we're talking about. If you're a high performance thrower, take your recovery serious, get your body back into balance. And if you can squeeze higher than, what is it, 180?
185.
185. Tag. Where can people find you? Where can they follow you outside of your website? Are you
at Form Function PT on all medium, and then formfunctionpt.com is the website. Got all kinds of good information there.
Awesome. Love it. All right, everybody, get out there, do some movement. We'll talk to y'all soon. Thanks, Trevor.
Thank you.